Welcome to Medicare Events Training. Today we're really going to discuss how to elevate your business to that next level using Medicare events. But before we do that, we got to first identify what type of events Medicare says is compliant and how to execute those events. So let's go ahead and get started. There's really two types of events in the Medicare world. There are formal and there are informal events. So let's dive into the formal events. Formal Medicare events, they will start at a specific time and they will have a presenter who leads an audience of attendees. While informal Medicare events really have a time range where a licensed agent will be available to answer questions when approached. This will look more like a booth. Okay, and if you want to see images of the difference between formal and informal, you can see that formal is on the left side of the screen there. And the presenter there is leading that classroom of people, and she says, it's 2 p.m., let's go ahead and get started with today's presentation. That is what formal looks like. Informal is the image on the right. That means an agent's going to be there, let's say from 10 to noon, and they are available to answer questions. And this is something that is not active, it's passive. Informal is passive, meaning you've got to sit there and allow prospects to come up to you. You can't be yelling at them and like calling them over to your table. So in the world of formal events that start at a specific time and have a presenter, there are two different types of formal events. There are formal sales events, which are meant to steer enrollees to a specific set of plans or a specific plan. You're going to sell a specific Medicare plan. Most of these are done with Medicare Advantage plans. Now, the other type of formal event is a formal educational event. Same type of format, and they're designed to inform potential enrollees about Medicare and other healthcare options. You really don't talk about benefits in an educational event unless you're specifically talking about Medicare. Now, one thing you need to know, and this is going to be in your annual testing that you get through AHIP, is that sales events are prohibited from taking place within 12 hours of an educational event in the same location. And the same location is going to be identified as the entire building or even like an adjacent building somewhere across the street. So you can't do an educational event and then steer people towards your sales event and anything less than 12 hours. So that is a big no-no. So let's stick to our sales events here. Now consider this like a do and don't checklist. So we're going to start with the left side here. So our intent in a formal sales event is we're going to sell a specific Medicare plan or set of plans from the same carrier to attendees. You definitely have to register these in advance with the insurance companies, and those insurance companies have different time frames. Some of them require 3 weeks, some are 2 weeks. You got to check with the insurance company to know when you must register them in advance. You can provide light snacks. You are not allowed to provide a meal at a sales event, and the nominal value is $15. That's the max that you can provide a snack per person. So snacks are like a muffin and maybe a drink. But if you start doing a muffin and a side of pancakes and a drink, that could be considered a meal. So do light snacks only. You are allowed to take scopes. You can set appointments. You can collect leads. You can even sell plans right there on the spot. And you can distribute plan-specific material. Okay. Now here's what you can't do in a sales event that's formal. You cannot require the contact information to attend the event. So you can put in a name field, but the rest of the fields must be optional. Okay, so you can only include the attendee's name. Now you can have an RSVP form that has a field for phone and email address and all those other fields, but they must be left optional. You cannot conduct health screenings anywhere near a sales event. You cannot use information collected from raffles for other purposes. So some folks may say, hey, if you attend this sales event, we're going to raffle off XYZ. And once you raffle XYZ off, you're not allowed to take all of the raffles and then use them to call people later. Okay, and you must use an approved presentation, and you can get that from the insurance company themselves. So formal sales events are done nationwide. And insurance companies like to use their captive channel and sometimes employees to conduct these sales events. But you, as an external broker, can also do this. And if you work with the insurance company, a lot of times they may help you market these events. And that's one of the reasons you may want to do a formal sales events and limit yourself to one carrier's plan during that presentation, is because they're probably going to help you with the marketing part of it. Now, this is what a formal sales event would look like if we were going to assign it an image. So you're going to have somebody at the front of the room, and they're going to be presenting a specific plan. So for this image here to the right, this individual says, hey, he's going to be marketing and trying to sell you a Humana Medicare plan. But it could be United Healthcare, it could be Anthem, it could be Cigna, or one of the other insurance companies. You're going to be talking about specific benefits of a specific plan. Now let's dive into the educational do's and don'ts. Now, the educational do's, this is what you're trying to do. Your intent is to educate only. Okay, we are not talking about the benefits of a United Healthcare plan or a Cigna plan or an Anthem plan. You are only talking about Medicare benefits themselves, and you're going to give some high-level overview of what an Advantage plan is and what a Medicare supplement plan is, but you're really not going to talk about the benefits. Educational events, they can be sponsored by Medicare professionals or some other healthcare provider. You are allowed to provide meals, but the nominal value still remains at $15 per attendee. You are allowed to pass out business cards. You can collect leads as long as it's voluntary, and you're going to do that on an insurance company's version of a business reply card or your insurance broker's business reply card. And that's kind of the sum of it. Here's what you can't do. You cannot discuss plan-specific benefits other than that of Medicare itself. You cannot take enrollments. You cannot distribute applications. You cannot distribute scopes. You cannot collect scopes. You cannot set future appointments. And the contact for RSVPs after the event that did not voluntarily give you specific written permission, that prohibits you from calling that person. Now, if they filled out a business reply card and specifically said you can call them after the educational event, you can do that after the event takes place. But you cannot call your RSVP list and then say, hey, you attended my event, because unless they gave you specific permission to call them, which they gave you in the educational event, it's prohibited from calling them. So it's a little bit trickier to handle those RSVPs in an educational event. Okay. And at the Medicare Resource Center, we have a whole host of educational presentations. Our most popular is the Getting Started with Medicare. That is a specific to people that are turning 65. But we also have other educational presentations like Prescription Drug Saving Secrets, the Medicare Extra Help Program, how group health insurance works with Medicare, and a variety of other presentations. So if you're looking for a prepackaged Medicare approved presentation, Medicare Resource Center, we have them. You just log into Boost and you figure out how to download that for yourself. Okay, so when it comes to formal events, there are two types again. There's formal sales events and formal educational events. But there are also other types of events which we sort of brushed on called informal events. So informal, once again, this is a time range. This is somebody like setting up a table at a retail location, a YMCA, so on and so forth. This is passive. You must be passive in nature, meaning you cannot call people over to you. You get the retail locations that you're going to be working in, if you do informal events, they do not want you harassing people, in other words. And there's also two types of informal events, just like there were formal events. There's informal sales, same concept here. You're going to be flying the flag of an insurance company, or you could do informal educational, where you can still fly the flag of an insurance company, but everything is educational in nature. You can only talk about the benefits of Medicare, and the same rules apply for formal events for educational and sales. No big difference there. Now, looking at this image, there's image 1 and image 2. Can you tell which one of these is an informal sales event and which one is an informal educational event? Well, in image one, if you guessed that was a sales event, you are correct. You can see behind the lady there that United Healthcare is being displayed, and they're talking about membership cards and specific benefits. Or image number two, there is no plan-specific data available. Okay, they're just simply waiting for people to come up, ask them questions about the Medicare program in general. Okay, so let's look at informal educational events and where these would be a good place to do. This will also apply to informal sales events as well. So YMCAs or any other like silver sneakers or fitness benefit of a certain insurance company, that location is an excellent place to do informal educational events. Health fairs, expos, waiting areas where care is not being delivered, because if care is being delivered in a healthcare setting, you're not allowed to do anything informal. Grocery stores, Walmarts, Walgreens, Hy-Vee, drug marts. Some insurance companies can get you in there if you want to do an informal sales event. Okay. Food pantries, senior centers, festivals, concerts, you kind of get the point. Okay. And the same thing goes for informal sales events. You can literally do these in the same locations. We used to do informal sales events at Walmart until Walmart got their own field marketing organization, but we still do them at Kroger's and we still do them at Walgreens, so on and so forth. All right. So Medicare events, if you want to take your book of business to the next level, events is how you really accelerate that. And conducting the event is not only going to give you an amazing lead funnel, but it's going to give you future sales, okay? But getting prospects to attend your event is going to be the most difficult challenge you face. So a lot of agents, when they want to do formal sales or educational events, they get hyper-focused on the presentation part. That's the easy part. We're going to show you certain slides to memorize and how to equip yourself for that. Your hardest challenge is getting people to attend, okay? So some people say, well, which events are better? Is it better to do formal or is it better to do informal? Well, I can't tell you which one's better, but I can tell you the attributes of each. So with the formal event, they're far more expensive to execute, but you do get an immediate return on your investment. You get leads that you can work right now, and a lot of times leads that you can sell within the pretty immediate future. Informal events normally will cost you nothing other than a fold-out table, maybe a banner and a table banner, and some materials to put out, maybe some donuts or some fruit or bottled water for people to come up and drink, like maybe after a silver sneakers class. So they're very low cost, but it's a huge time investment. So when folks are asking us about, hey, I want to do an informal event at, let's say, a fitness location, I'm going to tell you that you need to at least invest 6 to 8 weeks in showing up on a weekly basis, sometimes twice a week. It's going to be 4 to 5 weeks before people are going to trust you enough to even approach you and talk to you. This is not a one and done, I tried it once. This is a commitment. And I'm telling you, probably need at least 2 months to get in there and get to know the people. Eventually, people will come up and talk to you, but it'll feel like a failure probably for your first 4 weeks. A lot of agents just don't hang around long enough and commit to doing an informal event long enough to reap the benefits of it. But I have seen agents build a huge book of business on informal, but just remember, it's lower cost and it takes a little bit more time than a formal does, okay? So formal events is really one of the fastest ways that you can build your book. But this normally is going to take some sort of a financial investment from you if you want it to succeed, okay? So what we're going to do next is really dive into how to execute these events. So we're going to go through some bullet points here. The first thing you need to really consider is the location which you're going to do it at. Then the next thing is, how are you going to market your event? How are you going to manage those RSVPs? How do you execute the event the day of? And what's the follow-up procedure? So let's look at location selection. Location selection is very, very, very important. you want to make sure you're in a place that has appropriate lighting. People need to see the presentation. So if you're in a space that the lighting is dull and your presentation cannot be seen, maybe you want to look somewhere else. You want a place that's well lit. You want a place that isn't noisy. A number of these formal events are done in restaurants, and we used to do one in a chicken place years ago, but it was very, very loud and it was full of distractions. And a lot of people are having trouble hearing the presenter. So you really want to find a room that's set apart that really, if you could find a closed door, do it. It's not mandatory, but it probably be something that you should consider so that your audience can hear you. You need accessible seating options. So you don't want people with their back face to where the presenter is. So round tables are a good type of setup so people can like turn around their chair. Or classroom style, we'll show you some examples here in a minute. And you got to make sure that the space is handicap accessible. So if you're trying to do a presentation at a place that has an upstairs with no elevator, that is a no-no. It must have an elevator. You've got to make these places accessible by the public and accessible by people that have mobility challenges. And you really need to also consider what media that you're using. So a lot of people used to use a projector. You can use a portable projector, a portable screen, but really it's probably best if you find a restaurant or a facility that already has like a LCD or a high-def TV that you can plug in like an HDMI to. Try and find facilities that already have media in place for you so that you can execute this through a PowerPoint, which I believe is really the most professional method. Okay. Now, this is an image of a room. Now, this is called classroom style, and this works really, really well. This is an excellent room if you look at it, okay? But these rooms must be open to the public, so you can't really do this in a private club that requires a membership. You can't do presentations where gambling or there is a casino that is somewhere within the vicinity, so stay away from casinos, gambling areas. And you really don't want to do this in a healthcare facility unless they have like a common area, an area where people do not receive care. So you can do it, let's say in a hospital setting, but you can't do that like in a hospital room or even like a hospital waiting area. You probably want to find a separate room somewhere aside that has a closed door so that you can market the event separately from places that people would receive care. It's just a no-no, so stay away from that. All right, so let's look at marketing your event. So now once you select a location, the next challenge is going to be how do you get people to come, okay? This is going to be your biggest challenge. And if you do nothing, your results will reflect that because we've tried a lot of nothing in the past. We've experimented with Facebook marketing, direct mail, just Facebook, just mail, combination, and even done events where we didn't market it at all to see what would happen. So we're going to give you some pretty cool tips here on how to market your event. The first place you definitely want to market this event, and the easiest, at least if you're a broker with the Medicare Resource Center, is put it on the website that we've created for you. And when you do that, it will also automatically, as of now, go to Eventbrite. Now, what I'm going to recommend is when you put it on your website, you probably want to put it on Eventbrite separately because Eventbrite is its own platform. We don't own it, and every time they change something on their website, we have to create a new gateway. So eventually, I think the best way is first website, then Eventbrite. But you want to supplement this direct mail. That's probably going to be your best contributor to attendees is direct mail. You probably want to do something a little on social media. And when I say social media, I'm talking about Facebook. You can supplement it with digital ads and newspaper. Newspaper is almost dead, but you could do something like a press release. Newspaper used to be a big generator of leads, but newspapers are dying. Everything is going online now. So again, I really think you should stick to website, direct mail, social media, maybe supplement with digital ads. And if you do newspaper, I would simply do a press release, especially for something educational. Okay, so let's look at the your website. So all you have to do is access your Boost dashboard, and you're going to go right over here to the tab under your account that says Manage Events. Once you get there, you're going to choose the type of event, the date, the start and end time, how many people, the event that you're actually presenting. So that would be like getting started with Medicare or prescription drug saving secrets. You got to indicate how many tickets, that's how many people can RSVP, because if you only have a room that holds 25, you don't want to book 50 people. And then you got to put the venue name of where that's going to take place and the address. Okay, then you're going to create the event. When you create the event, it's going to go on your main website. And right here we got an example of an agent that did one. And we pulled this image directly from the bottom of her website. So not only did it appear on her website, but it also appeared on the main website, which is heavily advertised year-round for people to find your event that way. And then you can supplement it by going to Eventbrite. It's free. You basically put in the same information. And now you've got 3 different web-based places that event is on. Now, I'll tell you, that is not enough. You will get RSVPs, but your count will be low. If you want a lot of RSVPs, and I recommend you do that, you're going to have to do something a little bit more. Direct mail is going to be what you're going to want to do. This is going to be your biggest producer of RSVPs, and it's expensive. Now, what we recommend is picking the area, like putting a pin on where that location is, and going out a certain radius where you can at least get 2,500 pieces put out. Now, 2,500 pieces will give you a nice return. If you can only afford to do 1,000, or you can only afford to do 500, that's acceptable, but just keep in mind that your RSVP count will be a little bit lower, okay? Now, social media, I recommend Facebook. Facebook is one of the craziest marketing machines. If you understand what Facebook is, yes, it's social media, but it's way more than that. They have lots of data for sale that you can buy, and they make it really simple to do it. So if you do a Facebook ad, like if you're going to do a meeting and you're going to generate that on Facebook, you want to make sure that your call to action, that button digitally goes to the place where people can RSVP. It's very, very important that you do that, because it's not only just, hey, putting it out there on Facebook. You want to know that when they click a button, which you get to design, you can make it say more information or RSVP here. However, you want to make sure it goes to a place that you can capture that data. Now, as somebody's scrolling Facebook, they may see your ad, and then when they click on it, you want it to go, well, in this case, it would go to the agent's site under the event tab. So this is a Medicare agent website. This is Val Baker, and she has events scheduled. And if she clicks the event tab on her website, it will give her a URL. That URL is displayed on the right there. It's resourcemedicare.com/MedicarePro/ValBaker/events. So you really don't want to put that domain in there. What you want to do is you want to assign the more information button to that domain, meaning when they click more information, they will land on this specific page where then Val can collect her RSVPs. Now, digital ads, some people wonder what digital ads. Here's some screenshots of what a digital ad looks like. You can work with a local marketing company. We have digital ads that you can pick from. So digital ads are those things that when you're scrolling in an app, you'll see an ad pop up. Sometimes they look like this or very tiny at the bottom of the screen. Of course, when you touch it or click on it, more information. You get to design the call to action. It's going to take you right to the place where you can RSVP. One of the things I like about digital ads is you can measure how many people clicked on it or how many impressions you made, so you can get a really good indication on your return on investment. Now, digital ads are okay for events. It's not your creme de la creme. Direct mail is that. But if you want to supplement it, you can do it. I don't think digital ads are a great idea for events. They're really good for like getting one-on-one appointments, using it a different way, but you can supplement it. But your return on this, not that great. Okay. And so no matter what digital ad or online marketing you do, just remember you need to give them a way to digitally RSVP so that you can know who's coming to your event. And of course, newspaper, we kind of talked about that already. I think the best thing you can do with newspaper is really just do a press release, and that would really apply to educational events more than it would sales events. So you can do it. It is successful. You might get 1 or 2 RSVPs by doing a press release in your local newspaper. Now, if you want a company to do all of that for you, you can spend a lot of money. There are third-party marketing organizations. Here's one called Leading Response, and they literally do all that for you. They send out the marketing piece. They bring in the RSVPs. They have their own client management system that you log into, and you can look at your RSVPs. So they have their own telesales unit where they book them for you, and you're going to pay a hefty price for that. But if you're a busy agent, you just want to throw money at it, here's a company called Leading Response. There's others that do it, and we found it to be pretty good. It's a pretty good investment, okay? So here's the website. There's the 1-800 number, top left-hand corner. If you want to pause and write that down, you can call them, and they'll do this for you, okay? All right, so that kind of covers the high-level ends of marketing your event. Now, managing RSVPs, if you don't have a company do this for you, this is a lot of work. So you've got to determine your voice over IP number. You can remember, you got to record these incoming calls. It's a CMS requirement. And so you're going to have to be available to answer the phone, because once the direct mail piece goes out, these RSVPs come in very, very rapidly within a quick amount of time of when that direct mail piece hits their home. So you could end up taking 3 or 4 calls in a day and missing some calls because you're on hold. It's one of the disadvantages of doing the RSVP yourself. It normally is a phone call, and the ones that don't come in by phone will come electronically, which doesn't require you to be there. So remember, you can only require their name. You cannot require email, phone, address, birth date, or any other identifiers. All of those must be optional. Now, what we found is we put a little asterisk next to the name. That means it's a required field, and the rest we don't put the asterisk, meaning it is optional to fill out that part. Most people fill out all the parts anyway. Don't let that be a barrier to you doing it. So once you get an RSVP, you need to immediately confirm them. So if you're doing it digitally, there is a process that we can help you with that you can automatically have something sent out to them, okay, saying, hey, thank you for RSVPing. But the ones that come in that way or by phone, you would definitely want to follow up with a phone call. Hey, my name is Jason. I'm here to confirm your RSVP. I got it. Just want to make sure you're all settled, just to make them feel good. And you want to do that just as quick as you can to getting the RSVP. Now, 7 days before your event, you want to confirm it again, just to make sure it's on their radar. And then the next thing is the day of your event. A lot of these events take place in the evening, at least educational events do. You want to confirm that in the day, just to make sure that they're realizing that at maybe 6 o'clock that night, they're going to show up. This will definitely help your show up counts before your event. If you don't confirm these RSVPs and you don't call them at least 3 times, you can expect about half the attendance if you had. So it's a lot of work. You're going to have to set aside time to be able to do that. Now, the execution of your event, this is what agents get the most nervous about, but we're going to go through some compliance measures and some ways that if you're doing a presentation that's already in a box, how you can really kind of prepare yourself in little phases. But if you have an RSVP list, you are allowed to print that and have that on site. It just cannot be visible to your prospects. So you are allowed to have it, but just make sure it's covered where your general attendee cannot see it. That's one of Medicare's rules. Okay? Now, I'll tell you, I'm going to preface this execution part with this. This is a job interview, okay? People are going to look at other events. They're not just going to coincidentally go to your event. The chances are, if they're in your event, they went to somebody else's event. Or after your event, they're going to go to somebody else's event. We're not the only ones doing this. So if you really want to be successful, you've got to actually become the expert. Don't practice being an expert. Become an expert. Know your stuff. You will exude a certain confidence, and people are going to see that, and they're going to choose you over somebody else. So I always tell agents, consider this a job interview. They're going to hire somebody to manage their Medicare. You want it to be you, and you want this to be as professional as you can get it. Okay, so let's just take an example of one of our presentations called Getting Started with Medicare. Now, to get ready for your presentation, so I'm just going to use our presentation as an example, at least one of the presentations, has 78 slides. What you don't want to do is try and memorize all those 78 slides in one swoop. What I'm going to recommend is breaking this down in segments. For instance, the slides 4 through 16, that has everything to do with what Medicare is. Memorize those first. Know how to say them forwards, backwards, upside down. Memorize slide 4 through 16. Say it in your sleep and become an expert at those slides. And do not move to the other slides until you've got that almost by memory. Once you have it all almost by memory, then you're going to move and you're going to begin to memorize slides 17 through 33, which in our case, those slides are strictly about how you sign up for Medicare. Once you have mastered those, then you're going to go back to slides 4 through 16 and do a run through of slides 4 through 33 until you've got it where you almost have it memorized. Once you have that done, then you can go to slides 34 through 42. Those really deal with the gaps in Medicare. Same process there. And once you memorize those, do all 3 sections until you're an expert, and then move on to the last, which is additional plan options. So slides 43 through 75 really deal with, Medicare supplement, Part D, and what a Medicare Advantage plan is high level. Okay. So this will help you. So kind of dissect it into 4 or 5 parts, depending on the presentation, and learn them individually. And don't do this a week before your presentation. You should have these things memorized 6 to 8 weeks before you're even doing the presentation. And I'm telling you, if you know these slides frontwards, backwards, and you understand them, that confidence is going to come out, and people are going to do business with you because you're an expert. They view you to be an expert. Okay? The other thing you want to do in these events is, at least formal events, is you got to engage your audience. If you are just talking the whole time, kind of like I'm doing right now, your success rate isn't going to be as good. You really have to figure out a way to engage your audience. Okay. Now, I'm just going to give you an example. So on slide 72, and this, again, just an example of engagement, you want them talking to you about 33% of the time that you're talking to them. So 66% you, 33% them. And I'm just throwing some numbers out there. The more they hear the information from their peers, the more likely they'll understand what you are saying. This is a ton of information for them. A lot of them don't know this from Adam, and they're just trying to digest it all. And I'll be honest with you, it's very hard to digest in a 1-hour presentation, everything. So engagement is going to help it make it memorable for them. So slide 72, it basically has a Medicare Advantage plan and like a Medicare supplement side by side. Now, one of the things you can do for engagement is you can begin to ask your audience questions. Now, you can do this on a whiteboard or like one of those big flip charts, and you can begin to engage the audience by asking them certain things. Asking questions is selling. Telling is not selling. And this also works really well like on a one-on-one presentation, okay? So you can say something like this. You can say, hey, let's just make sure you understand this. So maybe on your flip chart or your dry erase board, you write Medicare Advantage versus Medicare Supplement plus a drug program, and then you put a line right down the middle of the page. Now, I would probably open up with some questions, and I would say, hey, how many times a year do you think the average person sees a family doctor? And if nobody answers you, pick somebody out in the crowd and say, hey, what do you think? And just get anything work, just a guess, and let them say whatever they're going to say. And then ask a couple other people, what do you think? What's your name, sir? Your name's Paul? Okay, so Alan over here thought it was 2 times a year. Paul says 4 times a year. Well, the statistical average, okay, well, hold on, I got ahead of myself. You first got to talk about premiums, okay? Now, we're really not supposed to talk about plan benefits, but the way you can address this is by saying, have you ever seen the advertisements on TV or a piece of mail? Have you ever seen it? It says 0 premium? And most people say, yeah, I've seen all that. What is that? Well, usually those are Advantage plans. Now, not all Advantage plans have no annual or no premium. Some have a small premium, but it's either small or none. Those tend to be Advantage plans, where a Medicare supplement will have a little bit higher premium. So one of the ways you can get the annual premium number out of your audience is say, is anybody in the crowd have a Medicare supplement right now? And almost always somebody does. And you say, okay, what does your Medicare supplement cost you? And, $140 a month, $150 a month. And then I'll say something like, okay, is it the same price as the day you bought it? So that they can understand there's price increases. Again, we're just getting engagement, and we're going to write those numbers right there. Now, when we get back to the conversation of, well, how many times a year does somebody see a family doctor? You're going to solicit that from the crowd, and then you're going to tell them the statistical average is 4. What about specialists? And so engage somebody else in your office. So that's specialty care. Those are all those ologists. How many times a year does the average person see a specialist? And some person may say 1, some may say 10, someone may say 5, but you're going to answer them like this. Well, the average is actually 4. And what about other things like tests, labs, x-rays? You do the same process and you kind of go down the list. One of the things you can do is say, hey, does the average person on Medicare go to the hospital every year? The answer is no, they don't. Does the average person go to the emergency room every year? The answer is no. So let's look at this from a Medicare Advantage and a Medicare Supplement standpoint, okay? You put a little line there and you say, okay, now, if I were on a Medicare supplement, let's say I sold you that one that you told me about, and it was $2,300 a year with the drug program, okay? How much did I pay as a consumer for 8 doctor's visits and 2 lab tests? Well, it was $2,300. Now, most people will tell you, well, I didn't pay anything when I went. And that's kind of the characteristic of a Medicare supplement. Yeah, you don't pay when you access the care. You pay a premium in lieu of that. So you go back to this 8 doctor's visits and 2 labs tests based on the numbers you gave me. That was cost you $2,300, did it not? And then you go back and you say, well, Advantage plans are a little bit different. Many don't have a premium, or they have a little tiny premium, and they have these co-pays. So if a copay for a family doctor was $10, well, then you got $40. And if a copay for a specialist was $35, so on and so forth. And you add that up and you say, well, on an Advantage plan under the same circumstances, you only paid $220. That's a lot less than what you did on a Medicare supplement plan, is it not? And then you can make them twice as sick. I can say your annual cost doubled, $440, still less than the premium of a Medicare supplement with a drug program. And on Advantage plans, you do have a maximum out-of-pocket protection, vision, dental, and you get all kinds of extras. You got to use a network. But in order for an Advantage plan to cost you more than me selling you a Medicare supplement plan, you got to be pretty daggone sick. Now remember, you're going to use their numbers for this demonstration, and remind them it's a demonstration only, because not every Medicare supplement and Part D program is going to have a $2,300 premium. It depends on what flavor that they buy, but this is so that they can understand the concept, okay? So any way that you can engage your audience, slide 72 is a great example of one of the ways that you can do that, okay? And so if you're using a dry erase board or a flip chart, they will be able to see that side by side, and then, that can probably inspire some questions for somebody. So when you get to wrapping up your presentation, you definitely want a very open, formal questions and answers type of scenario. So if somebody asks a question, you would definitely want to repeat the question. Okay, so if somebody says, hey, what happens if I'm on a Medicare supplement and I go to the doctor for the first time on a Plan G? They may ask you that. And you say, well, Plan G's vary in premium by state, or that really, you kind of want to encourage people to do maybe a strategy session, or fill out a business reply card, and we can talk about those exact things. But if it's a general question that you can answer, you would definitely want to repeat the question. You want to say, hey, that's a great question. I'm glad you asked that, because you want to encourage them to ask more questions. And when you're wrapping up a sales event, it's a different process than that of an educational event. Because at a sales event, you can ask for the sale, you can enroll people in the plan, you can provide kits, you can set appointments and take scopes, where at an educational event, you literally can pass out your business card, you can provide educational materials, and at their option only, they can provide you with a lead card. So it's very hard to get good follow-up from an educational event. Now, if you want to know what a business reply card looks like, this is a version of ours that we made ourselves. And this clearly states that, hey, by providing the information, it's giving us permission to call them. Okay? And another thing you can do is we have these recorded presentations. And at the end of an educational event, you can say, hey, if you would like a copy of today's presentation sent to you by video, please fill out the card in front of you. And that can kind of help you get more of those business reply cards for you to wrap up. So that really covers the educational part for formal events. Now, your follow-up, really, really important. You've got to do this with an extreme amount of urgency. Email, phone, text, however you can do it, as long as you have permission to do it, and you want to do it very, very quickly. Okay? So if you're doing an event at night, and let's say you got 10 people that filled out business reply cards, you want to call those 10 people the very next day. And probably a couple of times a day. I would do this for 3 straight days in a row. And if somebody doesn't respond to you after 6 attempts, what I would do is probably just say, they're probably not going to respond, or maybe you let a couple more weeks go by and you start doing emails, so on and so forth. But again, you can't really follow up unless they gave you permission to do that. And that's all we have on events. And if you have any questions, you can always go to resourcemedicare.com. And we look forward to training you in the future. Have a great day.